Thank you very much, Jeremy. A pleasure and an honor to be here, and a challenge to maintain now this enthusiasm when we are on Friday afternoon and late in the session. Um, I was very inspired by the little Francisco. He reminded me Che Guevara. I don't know. So I want to be your Che Guevara as well, even if I am a little bit. I have to launch a revolution now. Friday afternoon and Vatican City might not be the most appropriate place to launch a revolution, but this is a positive and healthy revolution. So I hope you will follow me on this one, because it will be the kind of white coat revolution. You know, the white coat that the doctors we used to. Okay, let's make sure that we have the strong health argument to finally elevate and accelerate action on climate change. To have a revolution, you need a mission. And I think the mission is very, very clear now. But to have a revolution, you need tactics as well. And let me put three tactics on the table here. One, we need a positive narrative. Basta with the apocalyptic now. We can't use it anymore. People cannot stand anymore. And you disengage people. So narrative, tactic of using the economic benefits, the health benefits, mobilizing anyone that can be mobilized, and of course, depoliticize. This is not a left-wing or right-wing issue. This is everyone is a societal division cause. And the other one is that we need to make sure that we use this holistic approach that has been discussed here. You know, I've been trained as a physician, and when you are trained as a physician, they tell you from the beginning that if you want to adjust the problem that a patient has on blood pressure, you need to be very careful with the medicine you are giving, because might have consequences and other disease that the patient have. So for me, as a physician, this holistic approach is something extremely natural. Maybe I lost it with the years, but it was very natural. And I think is the one, health is the one that can maybe put all of us around. So let me use a medical approach to this, okay? Not only the revolution, but we have the tactics now. So let's go on why. Diagnostic. And this is the diagnostic. This is the diagnostic. I'm not going through this. You know very well. Health is affected. Health is very much affected by climate change for obvious reasons that I will not elaborate, because it has been very nicely presented. And I think they are very well. We have tons of science, no controversy, no discussion around that, but no excuses either. And I'm looking at the legislation specialist here, because no excuses. One of these days, our politicians are going to be taken to the court, because knowing that their pollution was very high and affecting our citizens, they didn't took the right decisions yet. So since we have the diagnosis, those are my prescriptions. As a physician from a rural area, isolated, I don't know where, those are the prescriptions. Climate action means, one, protect and preserve the source of human health, nature, and therefore, stop this nonsense fight that we have with nature. As the white coat people, the health community at large, we have a responsibility to start to use our troops, our doctors, nurses, everyone working on global health or health at the large sense of the world, all of you, we need to start to tell people that fighting with nature is not good. It's really bad for all of us, and we are the losers no matter what. I like very much when people says, there is no planet B. What do you mean? If it was a planet B, that will give you the right to destroy this one? Which type of, I don't understand. Climate action means invest in essential services. It's the common sense revolution, actually, what we are proposing here. Stop to close this gap of people who still don't have water and sanitation and clean energy in the healthcare facilities. Come on, this will be a very good opportunity, and common sense, no regret investments. Climate action means ensure a quick and healthy energy transition. We can help a lot on this one. We, as the health argument, we can help to accelerate this transition to clean sources of energy that we all know that is definitely very, very, very much needed. But I think people need to understand that as we did a revolution on access to water, now we need to do it on access to clean sources of energy. We want to promote healthy, sustainable food systems. Who will disagree with that? I mean, for health, as you rightly say, if we implement the famous Paris Treaty, we can go home, the public health community, because the Paris Treaty is nothing else than a basic public health treaty. So it's done for environmental purposes, but all the actions that you need to take to implement the Paris Treaty is nothing else than basic public health interventions, including this promotion to healthy food systems. And of course, building healthy and livable cities. We need to work on urban health. We need to work with architects. We didn't mention them very much these 3 days, but architects, urban planners. I am married to an architect, so maybe I'm a little bit biased now that I think. But yeah, but I'm convinced, I mean, 70% of the people in 20 years from now will be living in cities. And if we want to talk about health, there is no way we escape doing something at the urban environment, urban planning, urban design, and the benefits can be enormous for our health. And of course, this is, again, I think, a common sense approach. We are giving subsidies to fossil fuels. Not only we are investing in fossil fuels, we are giving subsidies. And the amount of subsidies we are giving could cover perfectly all the money that we need now to engage on mitigation. Our hospitals are already paying the price. We never, in all of those economic studies we have around climate change, we never include exactly this, how our health systems are already paying an incredible price. So, thank you. Take it, thank you. So when people tell you it's very expensive, we are already paying it. Our hospitals are already paying. And of course, the health of the people is already paid. So climate action means health benefits. With your permission, and Andy will not like me for this, because I know, Andy, that I have to say co-benefits, but I love to use health benefits. If we do it properly, they can be proper health benefits, although are not, at the entry door was not exactly that. Air pollution. I said this a few years ago in this room already. Climate change and air pollution for us from a health perspective is the same agenda. The same agenda. 70% of the causes of climate change are overlapping with the causes of air pollution. And air pollution means 7 million premature deaths every year. 5 of them related to the combustion of fossil fuels, but it's still 7 million. So when you look at how the two agendas overlap, there is no other way than to think about our poor lungs. Normally they are pink and lovely and fantastic, and then we see people now on the right hand with these black lungs. Even if it was the person here, and this is thanks to our Dr. Kumar, our friend in India, this is the lung of a 17-year-old boy who never smoked. Well, here's the result. So please think about that. So now that we are on the revolution, we have the diagnosis, we have the tactics, we have the how we will motivate the people. What will be the outcomes? What do we need to do to convince our patients that this is what they need to obtain at the end? This is what they will obtain at the end. We need to respond to the crisis that at country level we are having already in terms of more dengue, more malaria, more diarrhea, more cholera. And of course, we need to provide assistance to these people. So to provide assistance means that we need more resources to respond to the crisis that is already happening. Something else we need to do, and this will be the result of the revolution, we will have climate resilient and sustainable health systems. And this is, again, nothing else than doing common sense interventions, reinforcing epidemiological surveillance, making sure that our healthcare facilities, maybe we put some solar panels instead of using diesel generators in healthcare facilities in Africa. There is no reason why Africa cannot have solarization in all the healthcare facilities at a very low price. And that's why we have created this Alliance for Transformative Action on Climate Change and Health, to make sure that the health system that contributes to 5% of the global emissions, we will be contributing. So the health revolution will contribute as well to decrease by 5% the global emissions of greenhouse gases. What's that? Huh? Not bad, huh? So we can be the white coats, but with a big green, big green condecoration as well, and not greenwash. I hope that most of these 5% of the global emissions from the health systems are coming from supplies, so we can reduce that. Nobody can say that we don't have enough evidence. Of course, we should create and keep with science developing the evidence, but we have it. And we have it since 1990, and we have been producing reports, translating those reports into policy recommendations, and hopefully we will make sure that all of them are very much available. Of course, research. We need to keep doing research, but making sure that this research will go to where we need to apply this research on very appropriate interventions, and the ones that will produce the most acceptable results. Research, as I say, this is something that WHO is doing on defining the research agenda on climate change and health, and we will make sure that everybody can contribute, and at the end, as I say, producing some results that will be the most pragmatic and action-oriented possible. Monitoring. We need to monitor the results. WHO is going to the cases and the COPs, as you know, and we are trying to mobilize the health voices of climate action. Normally, our population still trusts the health sector very much, 93% versus, apologies, politician 15%. This survey was not done by WHO, so I don't take any blame on this. And so we are still a trusted voice, so maybe we need to be even more present on the dialogue. And that's why this last year in Dubai, where for the first time ever we managed, after many years of fighting and presenting the health argument, finally we have all of these people attending, 50 ministers of health, more than 140 countries signed a declaration on climate change and health. It was the first ever COP at the Health Day, a lot of mobilization. Finally, the health voice was very much there, but this is not enough. What we were telling the politicians, the negotiators at the COP, we were telling them that they need to be aware that they are not just negotiating the degrees of Celsius, centigrades that we can increase or decrease. Whatever decision they are taking will have an impact on our health. So we want to tell them, if you postpone action by 2 years, this is how much it will cost you in terms of mortality and morbidity. So we will love to have an indicator on the COPs saying, in addition to how many degrees you are committed to reduce, why you don't tell us, why we cannot present as well the argument how many additional cases of lung cancer you are going to have. So include a health indicator, and that will be probably very important. So what is next? COP29, we are already working with them. I really hope that what was presented yesterday by mayors, by local governors, and with courage, I mean, a lot of political courage, I think it will be so nice to be able to present it at the COP29, because we hope that we will have again the opportunity to have a health day, and a very strong one. My final one is that we can go as far as legislation. And we saw in the last 2-3 years very interesting results coming from legislation, coming from people taking to the court their governments or their even big companies, corporate associations. So maybe this is a little thing that is growing, and the human rights approach is now gaining a lot of momentum. So putting all of those forces together, I think our revolution will be only successful. Thank you very much.